endocarditis, treatment of native or prosthetic valve endocarditis, enterococcal endocarditis. Now here we will see native plus prosthetic valve enterococcal endocarditis. In previous session, we seen the endocarditis caused by streptococcus and staphylococcus. Now we will see enterococcal endocarditis caused by the strains susceptible to penicillin, gentamicin, and vancomycin, the gram-positive bacteria. And the bacteria is Enterococcus faecium and Enterococcus faecalis. The first choice for the treatment of Enterococcus is always ampicillin sodium, the most commonly used drug and most significant drug for the Enterococcus. Ampicillin sodium, the adult dose is 12 gram per 24 hours intravenous in 6 divided doses, and duration of therapy is 4 to 6 weeks. Pediatric dose of ampicillin 300 milligram per kg per 24 hours intravenous in 4 to 6 equally divided doses, and duration of therapy is 4 to 6 weeks. If the patient is native valve endocarditis and the symptoms are less than 3 months, then use 4-week therapy. If symptoms are less than 3 months, and if the patient again with the native valve and symptoms is more than 3 months, then we need to use 6 weeks therapy. And if the patient is prosthetic valve, use the 6 weeks therapy. So here duration of therapy is depends on the symptoms in case of native valve endocarditis. If symptoms are less than 3 months, 4-week therapy. And if the symptoms is more than 3 months, 6-week therapy for native valve endocarditis. And for prosthetic valve, 6-week therapy. Another optional drug, we can use either ampicillin or aqueous crystalline penicillin G sodium. This drug we used in infection by the streptococcus, and adult dose is 18 to 30 million units per 24 hours intravenous continuously or in 6 equally divided doses, and duration of therapy 4 to 6 weeks as per this criteria. Pediatric dose of aqueous crystalline penicillin G is 3 million units per kg per 24 hours intravenous in 4 to 6 equally divided doses, and duration of treatment is 4 to 6 weeks. So we need to choose either ampicillin and aqueous crystalline penicillin G. The choice of drug depends on availability of this drug into the hospital, side effect of this drug, and patient tolerance. But the most commonly first choice for Enterococcus is ampicillin sodium. Then we need to add plus. The first drug is ampicillin. Then we need to add here gentamicin sulfate. The adult dose for gentamicin is 3 mg per kg per 24 hours in 2 or 3 equally divided doses, intravenous or intramuscular, and duration of therapy is 4 to 6 weeks. Pediatric dose for gentamicin 3 mg per kg per 24 hours in 3 equally divided doses, intravenous or intramuscular, and duration of treatment is 4 to 6 weeks. Ampicillin and penicillin inhibits the bacterial cell wall synthesis. These are the beta-lactam antibiotic. Gentamicin is aminoglycoside antibiotic, inhibits the protein synthesis in the bacteria. So the treatment includes ampicillin and gentamicin for Enterococcus. If the patient has severe IgE mediated reaction to penicillin, what are the severe IgE mediated reactions to penicillin? It contains anaphylaxis, angioedema, bronchospasm, and hypotension. If the patient is not able to tolerate ampicillin, penicillin, then we have another option. We need to give vancomycin. Vancomycin adult dose is 30 mg per kg per 24 hours. Intravenous in 2 equally divided doses. Duration is 6 weeks. Either native or either prosthetic. There is no criteria as we mentioned before. And pediatric dose of vancomycin is 40 mg per kg per 24 hours intravenous in 2 to 3 equally divided doses, and duration is 6 weeks, and recommended only for patient unable to tolerate penicillin or ampicillin due to IgE mediated reaction. Plus additional drug is same, gentamicin sulfate. As we mentioned before, the dose is same but duration is 6 weeks. So if the patient has native wall or prosthetic wall, the first choice of drug is ampicillin, and then we need to add gentamicin. And duration of therapy here is, if we are using ampicillin, then the duration of therapy may be 4 to 6 weeks and depends on the symptoms. For native wall, we will use 4-week therapy, and for prosthetic wall, we will use 6 weeks therapy. In native wall, if the symptoms is more than 3 months, then we will use 6-week therapy. And if the patient is allergic to the penicillin, IgE mediated allergy, then we need to give vancomycin and gentamicin. And duration of therapy is 6 weeks, either native or either prosthetic, no matter. So this is the therapy for enterococcal. endocarditis.